This morning, before I came here, I thought, I haven't thought about my knee in a long time. It feels normal. I can't even remember how it felt when I started here. In any event, let me tell you about myself a little bit. I'm a psychologist. I have a PhD degree, and I never believed in alternative medicine at all. Until I finally went to a regular doctor about my knee. Actually, I saw two different ones, and they did that knee to ankle x-ray and said, you need a knee replacement. I thought, I'm not going to get a knee replacement. I really don't want to do that. I have friends I have lots of friends that have had their knees replaced, one or both. The rehab time is awful, and most of them, if they got it early enough, needed another one in 15 years, and most of them are still in pain. So they've had this terrible surgery, which I hope you'll show that awful slide of knee replacement. I think if you look at that picture, you won't want to get one. In any event, I also had a lot of pain on my right knee, and I had sciatic pain on the left. That meant that one day I was almost unable to walk at all, and I thought, wow, I'm going to have to get a cane, then I'm going to have to get a walker, then I'm going to be in a wheelchair, and I certainly didn't want any of that. I did get a cane, I tried it out, doesn't help a lot, and I didn't like the image at all, so I donated it to somebody else. If I didn't like the image of a cane, I certainly wasn't going to like a walker or a wheelchair. In any event, as I said, I can hardly remember that I thought I needed anything like that. For instance, this morning I have absolutely zero pain in my knee and my hip, on the other side of the lower back. None at all. I'm one of those 80-year-olds that feel like 35, so I had to make sure I could still do some of the things I did at 35, which is walking pretty long distances without a lot of trouble. After all, one does like to shop. So although I won't be going back to playing tennis or downhill skiing, still I had a lot of fun doing that when I could. And I'm not looking for that. I simply didn't want to be unable to walk. And I really thought I had lost it, that I would not be able to walk. So when I saw the full page ad in the LA Times for Dr. Yu, I thought, I've got to try that. I mean, it's worth trying something non-invasive than trying something invasive. You don't want to try out surgery. You've got to try a few other things before you get there. So I expect that most of you here don't want to have either another knee surgery or the first knee surgery, or you wouldn't be here. So anyway, the treatments are terrific. The staff is wonderful. The best people to help you feel better. It's like a big, expensive, as if it were, spa. The kind of, you go away and stay a month somewhere and get all these wonderful treatments. That's what going to Dr. Yu's clinic is like. And the people that work for him are marvelous. So give it a try.